Picture this. A woman, 67 years old, retired librarian from Tucson, Arizona. She's sharp, independent, still active. Still, the kind of person who remembers your favorite book, your favorite chair, and the exact brand of tea you like. But there is one detail that doesn't match her life. She has not slept a full night in 3 years. Not because she can't fall asleep. She falls asleep fine, usually within 20 minutes. Phone down, lights out, eyes closed, done. The problem starts at 1:00 a.m., or sometimes 2:00 a.m. She wakes up in the dark like someone switched a light on inside her legs. The room is quiet, no sound, no dream, no obvious trigger. Just this. Her legs feel wrong, not painful exactly, more like restless heaviness, like her body woke up early and forgot how to return to off mode, like her legs never received the message that the day was over. She lies there for 40 minutes, sometimes 50, staring at the ceiling, bargaining with sleep. Come back, please. But morning arrives and she feels like she didn't sleep. She feels like she worked all night. And here's the worst part. She has tried everything that's supposed to help. Melatonin, chamomile tea, going to bed earlier, going to bed later, a new mattress. Nothing changes. Now, what nobody told her, not her primary doctor, not the sleep articles, not the melatonin package, is that what she was experiencing might not be a brain can't switch off problem. It may be a circulation/leg fluid dynamics problem wearing a sleep problems costume. And the solution isn't hidden in a cabinet. It's on the wall of her bedroom. 3 minutes. No equipment. No prescription. No previous experience with anything resembling exercise. And my job today, Dr. Thomas, is to explain how this works for adults over 60 and why this small position can change what your night feels like. I'm a physician specializing in cardiovascular health and aging. My focus is on how the circulatory system changes after 60 and what that can mean for sleep quality in older adults. What I see repeatedly in my patients over 60 is this. People have been managing broken sleep for years. They try solutions aimed at the brain, and almost nobody looks first at the legs, because for many people, the wake up at 1 to 2:00 pattern isn't random. It's the body reacting to what's been happening in the legs for hours, quietly, before bedtime. And it doesn't announce itself until the exact moment you're supposed to be entering deep restorative sleep. That's why it feels so unfair. Now let's put a number on what you just heard, because sometimes people need a measurable reality before they believe their own experience. Adults over 60 can spend up to around 40% less time in deep restorative sleep than they did at about age 45. That change is real and measurable in sleep studies. But the most overlooked driver behind it is often not stress, not screen time, not caffeine. It's frequently a circulation shift starting in the legs, a subtle pooling and redistribution, hours before bedtime. And that shift can trigger your nervous system to stay online at 1 or 2 in the morning, not because you're anxious, not because you're thinking too much, but because your body is handling housekeeping that should have been handled earlier. So what does the night actually look like? For a lot of people past 60, you fall asleep fine, maybe even quickly. Then, somewhere in the early hours, something pulls you back to the surface. The room is dark, your house is quiet, there is no nightmare, no loud neighbor, no sudden worry, just a heaviness in the calves, a restlessness that feels internal, almost like pressure without pain. And then you do what most people do. You try to force sleep back. You watch the ceiling. You watch the clock. You wait. And sleep moves just out of reach, like it's slipping through your fingers. Here's the reframe. That is not insomnia in the way most people use that word. For some older adults, it can be their circulation doing something it has waited too long to do. Why the legs matter, and why it shows up at night. Let's make this simple. During the day, gravity pulls blood downward into the legs. Your venous system, especially the valves inside the veins, works like a one-way gate system. It helps push blood back toward the heart continuously. When you're younger, the system is generally more resilient. Vein walls are more elastic, venous valves are more effective, and the circulation responds smoothly to pressure changes. So by evening, the legs feel lighter. Bedtime is boring, in the best way. After 60, three common changes can gradually weaken this process. Venous valves can weaken over time, less tight sealing against backward flow. Vein walls can lose some muscular tone, less support to push blood upward. Overall, vascular elasticity decreases, less responsive pressure-driven circulation. The result? By evening, a meaningful amount of blood and interstitial fluid can remain pooled in the calves and ankles, sometimes not visibly swollen, not dramatic to the eye, but enough to change how your body feels. Now you lie flat, and immediately your body tries to redistribute what was pooled. The lymphatic system activates, your kidneys contribute to fluid handling, your heart and blood flow adjusts slightly with venous return changes, and critically, your autonomic nervous system, the system that switches you between alert and rest, can interpret this redistribution moment as not done yet. And that redistribution can be happening right at the wrong time, when you're supposed to be switching fully into deep sleep mode. So your brain isn't failing. Your body is doing a job you didn't realize was waiting. The good news? Here's the part that matters. This type of mechanism often responds quickly to the right input. You do not need to repair your veins overnight. You do not need medication to try a position that helps your body drain pooled fluid before lying down. And that's exactly what Legs Up the Wall does. But before I explain the setup step by step, I want to show you why this isn't just theory. A patient story, the moment everything clicked. This is Douglas Whitfield, 71 years old, retired civil engineer from Memphis, Tennessee. Douglas described what he called dead man's sleep. He'd fall asleep like a stone. Then he'd wake between 1 and 3 a.m. consistently. And when he woke, it wasn't dramatic. It was worse. It was endless. He'd lie awake anywhere from 30 minutes to an hour and a half, then drift back. And he tried everything: sleep supplements, different routines, different rooms, different timings. His wife started using earplugs, not because of noise, but because Douglas moved a lot in the second half of the night. When I asked Douglas about evenings, he described a familiar pattern, one I see frequently in men his age: dinner around 6, some television in the recliner, feet up, in bed around 9:30. Then I asked him a question most people never think to ask themselves. Do your ankles look puffy or feel heavier by evening? Douglas said sometimes, yes, mildly, but he always assumed that was just aging, just something you learn to live with. So I told him what I tell many patients, in plain language. I want you to try one thing for 2 weeks before we change anything else. His face looked skeptical. One thing? He didn't want exercises. He didn't want gadgets. He didn't want a new supplement. So I gave him the simplest instruction I could. 3 minutes before bed, legs up the wall, same time every night. That was it. Same bedtime, same routine. Nothing else changed. What happened in real life? 11 days later, Douglas messaged me. He wrote, I slept past 5 a.m. 4 times this week. And then he added something that surprised him: the restless, heavy feeling in my legs at bedtime. I didn't even realize it was a problem until it was almost gone. He also said his wife removed her earplugs, not because everything was perfect overnight, but because the second half movement was dramatically reduced. Now listen carefully. What changed wasn't Douglas's willpower. It wasn't his thoughts. It wasn't a magic supplement. What changed was the timing. The fluid redistribution his body was doing at 2 a.m. began happening, more efficiently, before he closed his eyes. So his autonomic nervous system arrived at bedtime with less urgency. Deep sleep became more available earlier, and the middle-of-the-night wake-ups softened. For many people, they don't vanish instantly, but they become shorter, less frequent, or less intense. That's still a major win. Now, here's exactly how to do it. And yes, details matter. Because if you do it wrong, you'll feel uncomfortable and you'll quit. Let's set this up properly. Step 1. Choose your wall. Find a clear stretch of wall in your bedroom. The wall beside your bed works perfectly. If your bed is against the wall, you can do it on the floor beside the bed. You need space to sit down and swing your legs upward safely. Step 2. Position the rough L shape. Sit sideways next to the wall, close enough that when you swing your legs up, your calves and heels can rest comfortably against the wall. Your body should form a rough L shape. Back supported, floor or bed, legs angled upward, calves and heels against the wall, and your torso relaxed. Your arms can rest at your sides or loosely on your stomach. Your head can be flat or supported on a thin pillow. Important, your legs do not need to be perfectly straight. After 60, hamstrings are often tight. A gentle bend in the knees is completely okay. What matters is that your legs are elevated above heart level. Gravity will do the work. Step 3. Timer. Set a timer for 3 minutes. That's the commitment for day 1. No stretching goals, no endurance goals, no burnout training. Just 3 minutes. Step 4. What you may feel during the 3 minutes. In the first minute, many people notice a gentle warmth, mild tingling, or a loosening feeling in the calves/ankles. That can be circulation improving in real time. But, this is crucial, you should not feel sharp pain, numbness, or intense discomfort. If anything feels wrong, stop and adjust. Step 5. Simple breathing. While you're in position, breathe slowly, in through the nose, out through the mouth or nose. Let your shoulders soften. If your mind wanders, that's normal. This is not meditation training. Just don't tense your body. Timing results. What changes when? Let me give you a realistic timeline, because expectations matter. Night 1. You might not feel a miracle, but some people notice their legs feel calmer at bedtime, even if they still wake once. Think of night 1 as teaching your body a new signal. Night 2 to 3. Often, people notice the restless, heavy sensation at bedtime becomes quieter. Not always gone, but less intense. Day 7. Many report shorter wake windows, fewer middle-of-the-night surfacing moments, or easier return to sleep. Instead of lying awake for 45 minutes, they drift back in 10 to 15 minutes, or sometimes they don't fully surface at all. Day 14. This is where the pattern becomes clear for a lot of people. They wake less alert and more rested, not groggy, not like they fought their own body all night. And the morning feels different, like sleep actually counted. By 30 days, if your body responds the way many adults over 60 do, you may feel a strong preference. You start doing legs up the wall almost automatically because you can feel the payoff during the day. Safety notes, please don't skip. This practice is generally considered low risk for many older adults. But I want to be responsible. If you have a history of deep vein thrombosis, DVT, severe varicose veins with complications, heart failure, uncontrolled medical conditions, glaucoma, or any condition where your doctor has limited lying flat or leg elevation, then check with your doctor first. Also, if you experience any tingling, it can be normal. But if you get numbness, sharp pain, or dizziness, stop. Back discomfort fix. Very common. Some people, especially with tight hips or lower back sensitivity, feel discomfort. If that happens, place a folded towel or thin pillow under your hips. It reduces the angle slightly and removes pressure. Serious. The most common mistake. The biggest mistake I see, people elevate their legs too high without enough support, or they twist their pelvis, and then they don't feel relaxed. They feel awkward. This is not about maximum elevation. It's about a comfortable, gentle elevation above heart level. A comfortable 3 minutes beats a perfect 3 minutes every time. Mobility-friendly variations, if the wall is hard. Not everyone can swing their legs up safely. If you have balance issues or limited mobility, try one of these. Option A, chair version. Sit in a chair near the wall, then place your calves/feet up on the wall if possible. Or place your legs on another chair so your knees are supported and your legs are elevated. Option B, lower angle. You don't need 90 degrees exactly. If you're uncomfortable, lower the leg angle slightly. Still aim for above heart level. If you can't do legs fully vertical, do your best comfortable elevation. Even partial elevation can still help some people feel calmer in their legs. A quick self-check, so you know if this is relevant. Ask yourself these questions. Do you wake up at a fairly consistent time, often 1 to 2 a.m.? When you wake, do your legs feel restless or heavy rather than purely anxious? Does bedtime activity feel fine, but the night is where the legs take over? Do you ever notice ankle/calf heaviness in the evening? If your answer is yes to several, you may be dealing with a leg circulation/redistribution pattern that this position can help calm. And that means you may not be solving insomnia. You may be solving a trigger. So what exactly is the answer here? The answer isn't that you're broken. It's that your body has shifted. After 60, circulation and fluid handling can become slower and more sensitive to timing. If redistribution happens right when your nervous system is supposed to transition fully into deep sleep, it can wake you from the inside. Legs up the wall may help move that redistribution earlier. That gives your autonomic nervous system a calmer signal. Housekeeping is already done, and deep sleep becomes more available earlier and easier to maintain. What to do right now? Now, here's your action plan for the next hour, not tomorrow. Tonight, find your wall. Set a 3-minute timer. Do it once before you get into bed, then go to sleep. No extra stretches, no extra supplements, just the position. If you want the 30-day challenge, if you want to make this a true transformation, do it for 30 days. 3 minutes every night, same wall, within 30 minutes of getting into bed. After 30 days, you'll know whether your body responds. And if it does, you won't be doing it because a doctor told you. You'll be doing it because you've felt what a full night of deep sleep does for the day that follows. Energy, mood, patience, morning clarity. Send this to someone. There's someone in your life who's been complaining about broken sleep for years. A spouse, a sibling, a friend, someone you see every Sunday. Send them this video, not because it's complicated, because it's finally the right explanation for the right problem. Closing and next video. If this video gave you something you hadn't heard before, subscribe to the channel. Next week, I'm covering something connected to everything we discussed today. There's a specific mineral many adults over 60 are quietly deficient in. Its job overnight is to help keep blood vessels relaxed and the nervous system calm enough to stay in deep sleep. Most people never get tested, most doctors don't bring it up, and many foods people think contain it after 60 are among the least absorbable forms. That video goes up next week, and it picks up exactly where this one leaves off. I'm Dr. Thomas. Take care of yourselves, and I'll see you there.